Hi, I'm Dr. Tonya, and today I don't just come to you as a radiation oncologist. I come to you as someone who has sat in your shoes as a cancer patient. And because of that, I know some of the questions that may be swirling around in your mind. And as someone who is getting ready to embark on radiation therapy as part of your cancer treatment journey, I want to help answer some of those questions and reassure you as you go on. Now, one of the questions that may be on your mind is, will this radiation therapy burn my skin? So that is what we're going to be focused on today as we talk. We're going to talk about radiation and how it affects the skin. Now, I'm going to try to make this conversation very clear, straightforward, and to the point. We're going to get rid of all of the medical jargon because it is my goal that at the end of this conversation that you have a clear understanding of what to expect going forward with your radiation treatments. Now, that being said, everyone is different and every part of the body being treated is different and the dose is different. So you definitely want to, after you listen to this video, talk to your doctor about the specifics for your treatment, but you'll go into that conversation already having a knowledge level where you can ask intelligent questions and really be able to understand what they're saying. So, will radiation therapy burn your skin? So the first thing that you have to understand about radiation is what type of radiation that you're getting, because there are lots of different types of radiation. So for the purposes of this conversation, we're going to assume that you're having what we call external beam radiation treatments. These are radiation treatments that are delivered like an X-ray treatment. You will lie on a table and the beam will turn on for several minutes and you'll get up. You won't see anything, you don't feel anything. And that is an external beam radiation treatment. Now, with external beam radiation treatments are localized. They are localized to the target area that is being focused on for your particular cancer. So any side effects that you get with radiation therapy will be targeted to that specific area being targeted. So for today's example, we're going to talk about the breast being the target for your treatment. So when the breast is being treated, the only skin that is being targeted with the radiation therapy is the skin in the breast area. And this may be the breast itself or the lymph node areas that drain the breast, but specifically, it's typically the skin in this area. Now with radiation tends to act just like the sun when it comes to skin involvement and skin reactions. So if you've had any significant sun exposure in your lifetime, you probably have a good idea of how your skin responds to sun. Now, if you are someone with a deeper pigment, darker skin tone, you probably tend to tan very easily and you don't typically burn very often, if ever. Or if you're someone who is fairer skin, lighter skin, you may notice that you don't tan at all. Or you may get red before you tan. Or you may be someone who burns very easily. So when you look at how your normal skin responds to the sun, to sun exposure, you can pretty much predict how your skin will respond to radiation treatments because it's very, very similar. Now, when it comes to whether or not your skin will burn from radiation, it really is dose dependent. Typically, radiation therapy is given in small doses over a period of time. And the dose is cumulative, meaning that it's going to add each day, and the total dose of your treatment will get more and more each day as you go on through the treatment. Typically, you won't notice any type of reaction from the radiation treatments until you've had about 10 or more treatments. Typically, if you're getting radiation treatments every day, after 2 weeks of treatment is when you will start to notice some changes in your skin. Typically, those changes will be if you tan, if you're darker pigmented, if you have a darker skin tone, you'll see a tan line develop. You'll be able to actually see a faint tan line develop in the area that's being targeted with the radiation treatments. If you're someone who doesn't tan, you will start to see some redness develop. Typically, you'll see a sharp edge on around the treatment area that's being treated. It's very, very subtle when it first shows up. It may be something that you kind of have to stand back in the mirror and kind of see, and you'll notice that outline. But typically around the 4th week of your treatment, you will start to notice a pretty obvious area where you've got skin reaction from the radiation treatments. And depending on how your skin typically tolerates sun exposure, you will start to notice whether or not your skin will burn. Now, typically, you will have some dryness, you may have some itching, and you may start to develop some peeling of the skin towards the latter half of your treatment. Most commonly with the types of radiation therapy treatments that are used nowadays and the types of planning that is used to plan your treatment, we don't typically see bad burns from radiation treatments. But you may see the redness, you may see the tanning, you may see peeling, you may see itching. Most radiation treatment centers will recommend or give you some type of skin cream to use on the skin to help minimize irritation from the treatment. You can check back on one of my other YouTube channels where I actually do some reviews of some popular burn creams, and that may help you decide which one to use if you're at a center that doesn't actually give you a sample to use. Now, there are certain circumstances where the skin is at risk. And if the skin is at risk and the skin itself is part of the target area, then yes, your skin will likely burn from the radiation treatments because your skin is the target. So the goal is to get enough dose to the skin to eradicate the cancer that's in that skin that's at risk. So in order to do that, in most cases, it's going to require a dose that's high enough that is going to make the skin burn. Now, if your skin burns, that skin reaction is temporary. It is a skin reaction that will heal over time. Depending on how bad the burn is, will determine how long it takes that skin to heal and how healthy the skin is around it. Now, if you develop a burn from the radiation treatments, you will be given medications to assist in helping that area heal as quickly as possible. You should get some type of pain medication, whether it be something that you put on your skin, something that's topical, or something that you take by mouth. But in any case, you will get some medication that will help that area burn and to make you more comfortable until that area heals. So again, will your skin burn during radiation treatment? Is one, dose dependent, and it depends on whether or not your skin itself is the target or if the area that's being targeted is beneath the skin. If that area being targeted is beneath the skin, it is unlikely that the skin itself will burn. And if it does, it will happen at the very, very end of your treatment. And it would typically be like an early sunburn reaction with some peeling, some redness, some itching, and maybe a blister will develop right at the very, very end. But once the skin starts to heal, it starts to heal very, very quickly. It will scab over, it will peel, the itching will go away, and you will notice generally anywhere from a month to 6 weeks to 8 weeks after you finish treatment, you may not be able to notice that you had any radiation treatment to that area at all. Or you may still have a tanned area in the target area of your radiation. But I will assure you that most, if not all cases of radiation skin burns will completely heal within 2 months after you finish radiation treatments. It is uncommon that if you've had any significant skin irritation or burning from radiation therapy that it is not completely healed within 2 months. Most commonly, it's healed much, much sooner than that. Your doctor will have you come back to the clinic generally within 2 weeks to a month after you finish treatment, really just to do a skin check to make sure that that area has healed, that you're not having any significant problems. But if you find after you finish treatment that your skin is not healing or it is getting worse, then you'll definitely want to give your doctor a call. They may want to have you come back in, take a look at it so that you can get whatever medications you need to make you feel better and to help it heal more quickly. So I hope that this conversation was helpful for you, that you got some information, that it was understandable, that the language was clear. If you found it helpful, please like this video, subscribe to this channel because I'll have a lot more information here for you on different topics, and share this information with someone that you love.